So one of the first cases I remember having many years ago was a young lady who came to see me because she was having palpitations and she was feeling sort of nervous and on edge, and she wasn't sleeping. And so initially my thought was, oh, maybe she's having an overactive thyroid. You know, she was a young lady, and we started to take the history and so on and so forth. And then came to, okay, are you taking anything over the counter, any herbal supplements and so on? And it came out that she had just started to take a weight loss pill. Now this girl, young lady, good looking, she really wasn't large. In fact, she didn't look overweight, but she had her ideal of how she wanted to look, the size that she wanted to be and so on. And so she went and bought one of these over the counter medications, and unfortunately, you know, in taking the medicine, she had this side effect where she felt like something was wrong with her heart, right? But it turned out that it was some sort of supplement, and she was not able to tolerate it at all. Obviously, we told her to stop that medicine, and her symptoms went away, and she didn't have to worry that, oh, she had a heart problem, right? Then I remember another case. This was a more middle-aged woman. She came into the hospital because she was erratic, like, and confused, and kind of saying random things and just behaving very strangely. And we weren't clear what was going on at all. Did a bunch of tests, you know, checked for stroke, all kinds of things. Anyway, within 24 hours, she came back to normal. She was normal, decent woman. She was so apologetic about her behavior. In fact, she felt a little embarrassed, you know. And then, so she was back to normal. So we got to speak to her and find out a bit more of the history. And it came out that she had started to take some sort of herbal supplement that she got on Amazon, online of all places. Her son had told her about this thing he heard about that could help with the weight, and she had a bit of diabetes, so she was just trying to optimize her weight and so on to help her diabetes. But lo and behold, it was something that just tripped her out, right? And so these are two examples of people taking medications or supplements to help weight loss, right, and suffering very serious complications. One case, a young lady with her heart beating fast and making her so uncomfortable, and then the older woman who became confused because of whatever it was in that supplement. We never found out what was in either of those two supplements, right? But clearly they were not right, okay? And so today what we're talking about is weight loss supplements and whether or not you should take these weight loss supplements or even medications. Well, I'm probably going to talk more about prescription or medications, right, as opposed to the supplements or herbal stuff that you might find over the counter or online. Should you take weight loss supplements? So I'm going to talk about the 4 of the commonest ones that are available, right? And then after, we'll kind of decide together, answer the question together, whether or not you should take the weight loss supplement. So one of them would be like a phentermine. It's a stimulant. Now, I'm not sure how common, like, I don't work in a weight loss clinic. I'm not sure how common this is used now, but phentermine, a stimulant, it's like an amphetamine-like stimulant that basically ultimately decreases your appetite. I think these things keep you going and going and going so much that you're not even thinking about food. You don't feel like you have to eat. You just go, go, go. And so because you're eating less, you end up ultimately losing weight, okay? Now, of course, because this is a stimulant, kind of like that young lady, you are prone to palpitations, like your heart beating really fast, or you just kind of feel a sensation like your heart beating. People might get tingling in their fingers and toes. Sometimes people might suffer from insomnia and, you know, other problems, right? So that's one class. The brand name I know of is Adipex, right? So Adipex or phentermine, an amphetamine-like stimulant for weight loss by decreasing the appetite. Now, another class of weight loss drug is this one. It's Orlistat, brand name Xenical or Ally if it's over the counter. And this one works by trapping fat in the intestines. Now, fat is more dense in calories compared to carbohydrates and protein. So the feeling is that, okay, we're going to trap all that fat in the intestines. And so ultimately, you are going to be in a bit of a calorie deficit because all that is going to be passed out. Now, this medication, because of all that fat you're trapping in the colon, what happens is that people tend to have pretty fatty stools, you know, stools that float. And this is gross, but sometimes they can actually have sort of oil, kind of incontinence of oil, right? It just kind of leaks out, right? So it's pretty gross, and this is not a popular medication at all because the side effects are just pretty gross, and people can get bloating and flatulence and things like that. So even though it does help to decrease the weight, ultimately it's just not tolerable for a long period of time, right? Now, another class of weight loss drugs, pretty common actually these days, is actually diabetes medications. These medications came about for diabetes originally, and then they found that, hey, these people are losing quite a bit of weight. maybe we can use these medicines for weight loss specifically. And so they kind of renamed. So there's the same diabetes medicine, right? So liraglutide, semaglutide, their brand names. Ozempic is common. We hear that advertising on TV all the time. But then the same drug, semaglutide, they market it as Wegovy, I think I'm pronouncing that correctly, for weight loss, right? And then the liraglutide, I forget the brand name of that one, for weight loss. But ultimately, how these medicines work, for the weight loss part, well, for diabetes, they decrease the amount of insulin that's produced in response to glucose. Sorry, they increase the amount of insulin that is produced by the body in response to sugar, glucose from the food, right? And at the same time, they decrease the amount of another hormone, glucagon, right? That would ordinarily cause high sugar levels in the blood. So they cut that down. Ultimately, the blood sugar comes down because of these two hormones, the effect on these two hormones. And then the other way, which is how it ultimately reduces the weight, is that it decreases the emptying of the stomach. So food would stay in your stomach for longer, so you feel full quicker. And because you have food more slowly emptying out of the stomach, it means you have a slower increase in blood glucose levels, right? And so again, that's where it helps the diabetes, but then also because you're just not feeling hungry as quickly because everything's emptying out slower. So ultimately you eat less, right? You get full quicker, you stay full longer, and then you ultimately eat less. And that is how you lose weight with these medications. And these medications, I mean, they also come with side effects, usually really not low blood sugar per se, unless you're taking it with other medications. But sometimes people have bloating and maybe diarrhea or constipation, just kind of GI upset, right? The main, like most common side effects. And then there are more rare side effects down the line, potentially if you take it for a longer period of time, right? So those work pretty well. In fact, a lot of people can have some significant weight loss with these medications, right? And then the last one is this one, it's like a combination of two, right? Contrave is a brand name, and it's a combination of bupropion, which is an antidepressant medication, strong antidepressant, and then naltrexone, which is something to counteract opioids like narcotics, heroin and morphine and things like that. So together, those two medications kind of alter or change the chemicals being produced in the brain, particularly dopamine. They increase dopamine, and that's like a feel-good hormone. And anyway, when dopamine is increased, somehow you just don't want to eat. Even though you feel good, you don't want to eat as much. So ultimately, this medication decreases the appetite, and because you're eating less, you lose weight ultimately, right? Now, the thing about these medications, right, as I alluded to, is the side effects. Are you going to take medications to lose weight and deal with these side effects indefinitely? Now, granted, a lot of times when you take medications, the longer you take it, the more you get accustomed to the side effects, or the side effects just kind of go away even. Like your body gets used to it, and so you don't suffer the side effects as much, right? But sometimes people still have side effects, right? Think about those stimulants on the heart and just irritability and so on. Think about the one with the antidepressant. That, you know, what if, I mean, some of these antidepressants, they just kind of make you, even though you're supposed to feel better, in a better mood, but ultimately they have these black box warnings about depression, about being suicidal and just kind of crazy things like that. And then of course that one with the fat, decreasing absorption of fat. Well, you need fat to absorb vitamins, the fat soluble vitamins, vitamins A, vitamin D, vitamin E, and vitamin K. And if you're going to be losing all that fat, you're going to trap fat soluble vitamins in your intestines, and so you could potentially become deficient in fat soluble vitamins, right? So ultimately you have to be so careful about, you know, these medications, taking them for a long time because of the side effects that can arise from these things, right? That's one thing to consider. The second thing is cost. Are you going to keep paying for these medications indefinitely, year in, year out? I mean, these costs add up, they mount, okay? So these are two things you have to consider. And then ultimately too, how much weight are you going to lose, right? Yes, you might lose some weight, but are you going to achieve that health benefit from losing the weight? The reason or idea about losing weight is that ultimately you are going to benefit, your health is going to benefit, right? Are you ultimately going to benefit by losing enough weight, or is it just going to be a small percentage, but still you have to take all the other medications and so on for whatever chronic illnesses, high blood pressure and so on and so forth, right? So what is the benefit to you? Also, okay, you're losing weight, but are you healthy? are you eating the right foods that you need to eat, right? When they talk about, when they market these medicines, they say these medicines should be taken in conjunction with a reduced calorie diet and with increased physical activity, right? So still the medical, I guess, system or medical industrial complex, you can say, is pushing this whole reduced calorie diet recommendation, right? Reduced calories, right? So what is the quality of those calories that you are getting? Are you getting enough protein? Are you getting enough healthy fat, right? Are you getting all the fiber from your vegetables and so on? Okay, yeah, you might not maybe be taking carbs per se, but, or is it that the calories that you're getting are predominantly carbs, right? Because you might be thinking that, oh, I'm okay, I can have carbs, I can have a little sugar because, hey, this medicine is working to keep my sugar down, right? So what is the quality of the calories that you're getting? And if you're just taking these medications blindly without considering whether or not your body is being nourished optimally, then you still could potentially suffer. Your health could potentially suffer because you're not feeding your body adequately. So yes, medications are there. It's an easy pill, quick fix. You can lose some weight, but it's more important to think about the health and the basically, yeah, the health. Like, how is your body functioning, right, as a whole unit? Are you able to fight off infections easily, right? Are you feeling agile and, you know, fit and just generally healthy and energized, right? So it should not just necessarily be about your size, but it's about your overall health and well-being. And you need to understand how to eat, right? Because if you're limiting your calories, but the calories you're getting are poor in quality, then ultimately you can become malnourished. So you can lose a lot of weight, but then if you lose a lot of muscle mass with that, because you're not taking enough protein, if you're deficient in vitamins and minerals and so on, magnesium, all sorts of things, then your body doesn't have the building blocks it needs to keep itself going and healthy and energized and, you know, to help you to have a long, you know, overall healthy life, right? So these are some of the things that you have to consider, right? Not just taking a pill, not just to drop the pounds, but to look at the quality of your body. Somebody can be a little overweight, right? But they are agile because they're moving regularly and they're eating good, nourishing foods, right? And they have all their numbers are good and so on and so forth. So, I mean, just because a weight is not in what we classify as normal does not mean that person is not healthy, because they feel amazing. So nobody can judge and say, oh, they're unhealthy because of their size. It's not just about size, but just the overall picture with your body and if it has been built up enough, right? So I recommend against diet pills in general, because you have to understand how to feed your body. You have to have an understanding of the quality of foods that you need to eat, right? Just again, to summarize, you need good protein, you need good fiber, good quality vegetables. Those are carbs. Vegetables are carbs, right? Just very complex carbs, right? And of course your healthy fat, and I think I said protein, right? So focus more on optimizing, bettering the quality of the foods that you have, understanding what you need to eat. And if you eat the better quality or best quality or better quality foods, ultimately your weight will approach the optimal, right? You will, if you stop eating, you know, like junk food and fast food and sweetened drinks and so on, you will lose weight. Like there will be weight loss, okay? So don't just depend on the quick fix pill if you're not fixing like the root, you know, support and building blocks of your body, right? So I hope you all found this helpful. And any questions, comment. Now, I run a challenge every 1 to 2 months. It's called the Eat More, Weigh Less Challenge. And so in this challenge, it's something where you will really have an understanding of how to choose foods to nourish and support your body and help to keep it strong and healthy and able to fight disease, as opposed to just kind of thinking only about absolute weight. It's not about absolute weight, but about the quality of your body and if you're able to build it up, right? So if you feel that that challenge might be something that you would benefit from, then there's a link below and you can click it. And I would love to have you on the next challenge in just under 3 weeks time. All right. Thanks for watching. Subscribe to this YouTube channel so that you can get updates for the weekly videos that I post. And also feel free to share this video to somebody else who you think might find it useful. All right. Bye-bye. Thanks again for watching.